What comes to mind when you think about an effective study session? Concentration, taking notes, efficiency, repetition? Well, in today's video, I'm gonna show you a sneak peek of my study method, of how an effective study afternoon looks like for me. And as you'll see in a second, it's quite different from how most people think an effective study session should look like. I'll walk you through the step-by-step of what I do every day to study. I'll share the best learning techniques I constantly use, and most importantly, I'll explain the creative ways in which I apply them to study medicine. Remember that if you want to learn more about effective study techniques, you can always watch my free masterclass on the science of effective learning. I'll leave the instructions in the comment section below. Alright, so the first thing you should probably know is that I don't do what most students do, which is study one thing at a time. And you see this all the time. A medical student thinks, okay, I have a medical exam in a month, about 10 topics, so what I'm going to do is I'm going to read one topic today, maybe tomorrow, but hopefully I can finish it today so I can pass on to the next subject tomorrow, and so on and so forth. Well, my study method is quite literally the total opposite. I organize my learning process using a technique called distributed study, where instead of tackling single subjects at a time, I'm always kind of learning bits of information, but from several subjects and at the same time. In my masterclass, I show several examples like these, several studies that show that when people study the same subjects, but they organize them differently, they organize them like in block, one at a time, versus distributed study, they always perform about 30% better when they organize them in a distributed or spaced manner, which 30% is a lot if you think about it. So what I do to apply this technique is to have a weekly study mindset. For instance, in this week, I'm studying 3 subjects, which are carbapenemases, antiretrovirals, and infectious considerations in the transplanted patient. And every single day, I'm studying just parts of each one of those 3 subjects, and I'm like interleaving them, right? Now, the next thing you have to keep in mind is that to actually start to study, I don't just start to read the article I downloaded or to read the textbook. No. I first try to apply a technique that will prime my brain to more effectively learn and absorb the material I'm gonna be eventually reading. In the masterclass, we discussed several studies that show why this is a great technique. For example, there was this study made by Cornell that showed that when participants were trying to understand and learn a specific answer to a question, and they just read it, they remember it worse than when they were asked to try to come up with a solution, with trying to generate a response and then read the information. So that's exactly what I'm trying to do here. Now, I tend to be very vocal in the fact that I think that the best way to apply these sort of techniques is to first do a test, like to really test yourself before reading the material. But there are multiple ways to do this, because people often have the misconception that the only way to do this is like to have a subscription to a platform like Ambos to do question banks, or to look for these clinical cases, or to do USMLE type of questions. But that's clearly not the only way. For example, what I did before starting to read the article on carbapenemases was take like a blank canvas in my iPad and start to write down what I remember from the classification of the beta-lactamases. By doing this, several questions start popping into my mind. I start thinking, was there a 2C classification in here? What is the spectrum of this specific beta-lactamase? And so all of these questions kind of start priming my brain, and then when I actually start to read the article, it's like my mind goes, oh, of course, so that is what I was mistaken, that I was correct with this other thing. And those moments, or moments of aha, are the ones that make the information really stick and be remembered. Now, when it comes to actually start to read, I like to take my iPad and I sit in the couch. And as you can probably imagine, this doesn't optimize the multitasking aspect of the information or the taking of the notes. And that is very intentional, because in this step, I don't care about any of those things. The only thing I'm truly concerned here is trying to process the information I'm reading, to pause, to think, to engage my mind. My favorite study technique to do this is called elaborative encoding, which in layman terms is just trying to connect the new information I'm being presented with previously understood information inside of my brain. So for instance, I was reading this New England Journal of Medicine article on the infectious complications of post-transplanted patients, and I came across this graphic. And in my experience, most students would just take a screenshot of this and put it in their notes, or maybe make a flashcard, which, yes, is practical, is fast, but as fast as it comes is also as fast as it goes. So instead, what I try to do with this kind of graphics is I try to pause and I try to think, okay, how can I connect all of this information to something I already know, that I already have stored in my memory? So let me think about it. So hey, for example, you notice how most of these infections listed under the 1 to 6 month category are very similar to the ones that happen in HIV patients? Well, that's great. Now, instead of thinking about this topic as a bunch of random pathogens that infect a specific patient, I think, okay, so the infections that transplanted patients suffer in the 1 to 6 month period are very similar to the ones that HIV patients suffer. Okay, I'm gonna remember it like that. Now, once I'm done reading the couple of pages that I set myself out to read, I like to stand up. Usually this is a standing desk, so I like to stand up and I start taking notes about what I just read using the modified Feynman technique, which again, I explain much more in depth in my masterclass, but in a nutshell, it's basically using the act of taking the notes as a form of auto-evaluation of the content, which is, in my opinion, the most active way to take notes, and the one that should accordingly give the best results. As I do the technique, I pay close attention to the subjects that I know I will struggle to remember later. For example, the antiretrovirals. I have studied like 3 times those suckers and I always forget the damn names. So this time, to prevent that from happening, I'm relying on something called retrieval cues, which are just basically the techniques that memory champions use to remember. The one I ended up using in this particular occasion were mental palaces, and some people really don't know how to use them, so let me give you like a taste of it. So the first couple of antiretrovirals I needed to remember were the ones that block the entrance of the virus to the cell, which are maraviroc and enforvitide. But those couple of names are kind of difficult to remember, you know what I mean? So what I did was that I imagined myself outside of my house, and I imagined like a 3D version of Maradona, like the football player, and he was with his shirt off, all covered in fur, like really like the most furry man you can imagine, completely more fur than skin, really. And I really try to let that sink in. I really try to imagine that horrible image. And so by imagining that horrible image, my mind goes, okay, Maradona. Oh, the first one is Maraviroc. And fur, why does he have fur, so many fur? Oh, of course, enforvitide. And so remembering this couple of names is hard, but remembering Maradona with a bunch of fur outside of my house is kind of more easy. So that's the first couple. Then I opened my door, and there were the next group of medications, which in this case are the retotranscriptase inhibitors, right? And there are several, but for example, there are a specific group of these inhibitors that are nucleotide analogs, right? And nucleotides, as you may remember, not only have the base but also the phosphate. So the first thing I remember, that the first thing I try to picture is like in one of corners of my garage, a bunch of pillows with a pH or Fs to remember me of the phosphate. Okay, so phosphate, and I really imagine those pillows with red. And on top of those pillows, there is Hades from the Disney movies. And there is also Ted Lasso. So when I think about this, I first remember the pillows and I think, okay, so these are the ones that have phosphate, these are the nucleotide. And then I think, okay, Ted Lasso, it has to start with tenofovir. And the other one is Hades. Oh, okay, it's also adefovir. And yes, of course, to create this sort of mental palaces, you have to be creative, you have to practice them. But once you create these mental palaces, trust me, it's far easier to remember these sort of medications. Now, the rest of the afternoon is pretty much the same. I continue reading bits of articles, doing some generation effect here and there, a few clinical cases here and there. I stand up, I sit down, I take active notes. But then when I start to not feel like I'm really enjoying the session anymore, I just stop. I prefer to have like 3 good hours of study than 6 mediocre hours. But yeah, as you hopefully just saw, effective learning is not really a matter of extra discipline or hours upon hours of study. No, not at all. It's a matter of learning to play with your brain, to use more advanced, more effective techniques to your favor, to prioritize true comprehension and not just practicality or velocity. But anyways, that was it for today. I'll leave you here another video on effective study techniques you might be interested in. And as always, I'll see you guys in the next one.